So the agenda today is first to describe this funding mechanism.
Also, we are recording, sorry.
Pardon me.
I wanted to remind people we are recording.
Robin, you should have told me earlier. I would have done my hair.
The other thing too is that we're going to put on the website a list of everyone's chat questions so that everyone's question will know got answered. So if you didn't get it answered today, you will in the future. So I'm the chat queen. Okay.
Thank you. So just as I go through a little bit of some jargon, so the ICTS is the Institute for Clinical Translational Science. That is the, it's an institute on campus that is funding this initiative. And the initiative that you're all applying for, or interested in applying for, is the CCRI, the Campus Community Research Incubator funding mechanism. We're going to discuss some of the specific nuance of this funding mechanism around conducting community engaged research. We're going to talk a little bit about what is different about this mechanism and how to address it in your proposal. So we really want to give you some tips on areas that you really have to highlight if you want to be competitive for this funding. We're going to talk about some common problems that we've seen in the past proposals and give you some ideas about how to prevent some of those problems. And then we'll open the floor to questions, answers, and discussion. Okay, so the Campus Community, the CCRI grant program, as I mentioned before, it's been around for more than 10 years. These are annual awards for doing community engaged pilot research and capacity building. So there are 3 actual different mechanisms in the funding announcement that you can apply for. The first funding mechanism, and this is all folded within the materials that you received describing the funding. So the first funding mechanism that you can apply for is asking for dollars between $3,000 to $5,000 for capacity building. So this would be programs like bringing in experts and hosting a meeting or conference around a topic that you're interested in building out, or inviting a number of community-based organizations to campus for a similar purpose, building infrastructure in order to support research, a research partnership between the university and the community. So these awards generally are capped at $5,000. You can ask for less, of course. But these are our capacity building activities, and they do still require some consideration around how you're going to evaluate the effectiveness of this capacity building. What are your milestones that you hope to achieve? Okay, I'll pause for a second. Okay, I'm looking, I can see you, Pam and Robin. So if you need me to pause to jump in, please do.
Okay.
The second award mechanism that we have, and again, we've had this same mechanism, these last 2 mechanisms for the last 10 years, is up to $10,000 for a pilot research project. What's new is that this year, for the first time, we are offering up to $20,000 for a COVID-19 related pilot project. So we're going to describe what are the requirements for each of these projects, but understand that depending on what the purpose is of your project, you have the choice for applying for the capacity building award, the pilot award, or the COVID related pilot. So if you have a project that is not COVID related, you are still welcome. We want you to apply to our usual grant mechanism, which is the $10,000 pilot award projects. But we also wanted to stimulate and account for, this new world that we live in. And we are really excited to be able to offer the $20,000 pilot award project for this year. Okay, now all 3, irrespective of what kind of project you apply for, it's important that you recognize this is not the usual pilot program offered through the ICTS. This is the Campus Community Research Incubator Partnership Award. The purpose of this granting mechanism has always been to stimulate partnership between the campus and the community in order to facilitate the ability for campus and community to partner together in research. So there's a couple words that I really want to highlight here. This is research, or it has to lead to a research project. And when I say research, sometimes we get stuck in, do you mean program evaluation or quality improvement? All of that. What I mean is that this is our efforts to stimulate partnership between community and campus in order to facilitate scientific investigation into problems that matter in the world. So it can be a program evaluation, it can be a quality improvement project, it can be a research project, but it's really important that it includes active consideration of a community and an academic partnership. And how you weigh that really has to be authentic to your process and the values of what you bring to the grant application. So community engagement in research sits along a spectrum where there is very low community engagement all the way to the other side where we have community-based participatory approaches where the community is driving the research agenda. And we are open to receiving projects along this spectrum. A project can be initiated either by a community entity or by an academic faculty person or student. But what's important and what's key to us is that there's evidence of a true partnership that is trying to be stimulated and formed. That there is evidence in the application that considerations around how these two entities or more entities, if so be it, are going to come together to develop a meaningful relationship in which there is a relationship that is going to be moving forward. And as many of you know who have worked in relationships like this, we know that when campus and community often come together, the issues around power and trust and competing issues need to be worked out. And we want to see evidence that a meaningful relationship is going to be stimulated with the outcome of making steps towards creating a lasting relationship that facilitates learning and knowledge and scientific growth.
Yeah, for the community organizations that are on the call, the way to kind of think about this is that a program evaluation is great. We all needed those. And the program evaluation results you're going to share with your board of directors or perhaps donors. Research will be shared with the community. Will the community's health or best practices be raised up by what you're going to find out? And, having the stepping stones of first the capacity building, then a smaller grant, and then a larger grant can be really useful. So for community agencies, that maybe will help you to decide the difference between evaluation and scientific rigorous analysis.
Okay, so what is the anatomy of the CCRI proposals? So in addition to having the regular requirements of a proposal, which would include sort of a description of the what you're going to do, there are some unique elements that we're going to have in this section. So issues around eligibility, budget, the strength or the potential for the research partnership, the translational nature of your project, and then letters of support. So let's go through all of these. Let me see, do I have another? Okay. So in terms of eligibility, every CCRI has to have a community partnership and a UCI faculty, UCI doesn't have to be faculty, excuse me, a UCI partner. So you have to have at least two people representing, one is the university and the other is a community group. Okay. As we said before, from the UCI side, the person can be a faculty or a student. From the community side, it can be a large organization or a small project. So we're looking for just each side represented. In terms of the budget, at least 50% of the budget has to go towards the community-based organization or towards the community side. So whatever your award is, at least half of the funds have to be spent by the community partner. Or said another way, no more than 50% of the funds can stay on the UCI side.
So do you want to do questions in between, Dara, or?
Sure, we could try.
And go ahead. Okay, so 501c3 is the most common nonprofit you hear about, but there are other designations of nonprofits, and the key would be, are they given a tax code, which is what the 501c3 is, that allows them to be a community benefit and exempt from taxes. So there's other organizations that have tax-free in a way, that are organized for the community's benefit. Sorry, I don't know all their numbers off the top of my head.
It's no problem. Robin, what's our requirement around, have we specified that it has to be a 501? You're on mute.
The only problem that we've had in the past is if the organization doesn't have some kind of way to accept the money. So it really revolves, I mean, it can't be for profit, but the organization needs to be able to accept money. So we've had a hard time sending money out to organizations that are not 501c3s. So that's why we kind of specify that. But if there's a way that the organization's able to accept money, then that's fine.
So I can see that there's another question that popped up. Oops, Robin, can you mute? I think there's another question that popped up from Allison about, I think if you have specific questions about whether some of these things we just haven't quite thought through yet. So if you have questions about whether or not your organization would be eligible, I recommend that you just reach out to us and we can take it on a case by case. Usually the 503s are really easy for us. If you're not, just reach out.
Yeah, and Allison, to your question, you are a 501c3. It's just that you pay somebody else to do your budget and pay your insurances. So you are an organization on your own. So I don't think fiscally sponsored will be an issue, because really that's just someone who pays the bills and maintains your bank accounts. So, but we'll get back to make sure that's the absolute right thing.
So let me tell you though, what's not going to work. So you cannot partner though with a entity that is UCI. So we did have, last time we had people who considered the federally qualified health centers that are part of UCI as the community partner. So specifically UCI, Santa Ana. If those are not community-based organizations, you can partner. If you are the community, let me rephrase that. If you are the community, you can partner with those organizations. But if you're UCI side, partnering with one of our satellite relationships that we already are part of the UCI family, that does not count as a community partner. So I hope that was clear. If not, we can come back to that in the questions and answers. So again, the budget, at least 50% of the budget has to go to the community, with the idea that both sides are really invested and committed to doing the research project. So these are funds that should be spent on both sides to doing the work that needs to be done. We're going to want the reviewers, want to read about the strength or the potential of the research partnership. So including in your application, where is this work going to go? So if you're going to apply for the capacity building, to what end? What is your next step? Make sure you make that clear in your application, that whatever step you're on, capacity building or pilot, that you can already start to see what your next step will be when you complete the project. It's also important that you cover the translational nature of your project. So where do you see it along the translational spectrum? If you are working, really far down on the bench, thinking about with COVID, there's a lot of work to be done doing, basic science work with the community as your partner. It's important that you also help to articulate how this is going to be translated, at least, as a potential, where you think the relationship will go. And then finally, for your letters of support, it's important that you have a letter of support from the community partner that you will be partnering with, as well as any other co-investigators that are going to be working on your project, perhaps even in a voluntary capacity. So we recognize this is not a lot of money and that many, many people are going to contribute sweat equity. And if there's going to be a lot of sweat equity involved, you want that reflected in your letters because it helps the reviewers to understand that this is a serious project with a lot of energy behind it, and it's worth making the investment because of the potential. Do we have to have IRB? I'll get to that in a second. So what are some challenges that we've seen? The qualification of the applicants. So in the last round, we saw that, again, I think I mentioned that community partners that were not, partnering with the federally qualified health center, that is UCI, wouldn't apply. If you partnered with a federally qualified health center like Share Ourselves or, there's a lot of them, Altamed, those are fine. Those are not UCI. So it's just the 2 sites at UCI that are not community partners. In terms of the applicants, we want to see people who are invested. So it would be from the UCI partner side, we would expect to see a biosketch or something that shows evidence that this individual is going to be able to facilitate the project. And from our community side, we want to see evidence that this is a person who understands the rigor and work of getting a project done and has evidence to show that they can do projects like this. So we want to just see both sides are bringing, what are the strengths that they bring to the project. Research versus program evaluation. This one's a little bit tricky, and I actually have a slightly different take on it than I think Pam did. And I think it comes from what these heavy laden words mean. I guess what I want to say to you is the idea here is that you're going to be working towards answering questions that are using systematic approaches to do that. And whether or not you call that program evaluation or research, again, I'm not sure I really want to get into the nuance of this, except suffice it to say, we're really interested in funding projects that suggest that it's going to lead to the improvement of human health, broadly down the line. It's important that you do, certainly in the pilot and the COVID pilot, that you put out either specific aims or 3 questions you're going to answer or a hypothesis even. You don't have to do a hypothesis, but traditionally we expect to see either 2 to 3, 4 aims, and that the methods that you propose are the appropriate methods and well explained to answer the questions that you've put as part of your proposal. Sometimes what we see is a very in-depth description of a program or a new exciting intervention or something new that a community agency is trying to do. But what we don't see is how you're going to evaluate the feasibility of the program, the acceptability of the program. You don't give us enough of the concrete steps about what are the research questions that you're trying to answer in this application. So you have to go beyond just describing a terrific program and help the reviewers to understand how this is going to contribute to a furthered relationship between the campus and the community around a research aim. Okay, another area where sometimes the applications fall flat is around feasibility. So we know we're asking a lot for $10,000 or $20,000. And again, sometimes because the aims are so broad and the methods are not well described, we question whether or not the project is even going to be able to be completed. So I don't think any of us believe that you're going to be able to do a randomized controlled trial of 150 people with $10,000. So it's really important, if you think you're going to propose that you make it really clear what other funds or resources are you going to leverage in order to support the work. So we only can evaluate what's on the paper in front of us, and generally the applications that rise to the top have very clear aims with a method that appropriately is designed to address those aims, and that there's evidence that this is a feasible project. Innovation is also important. Is the project ultimately answering questions that are interesting? It's important that you think about how are you going to recruit and retain people. And then again, tailored interventions need to be described with a little bit of detail in order to be able, again, to speak to the feasibility and innovation of the proposed intervention. And then fundamentally, we do ask a review board to come together that includes community and UCI faculty, and having an application that's well written, that has hit each of the boxes, that isn't sloppy, really helps. We occasionally have the sense that, because this is, people just take an application they had sitting somewhere else, put it onto the form and send it to us. And so that doesn't help, because we do have to go through a systematic review, just like all reviews for the ICTS, and an application that is really clean and thoughtful, those tend to rise to the top. Okay, so let me go back. I saw one question pop up from Banush. Okay, do you have to have IRB, or can the ICTS? So you do not have to have IRB approval prior to your application, but it does help. I mean, that would be one of those things that if you did have it, certainly I would talk about it in your feasibility. But no, I mean, we do, that's one of the areas that the ICTS will step in and try and help you complete the IRB process once you've been funded. Am I right about that, Robin and April?
We can give some guidance. We cannot hurry up the IRB evaluation side of it, of course, because that's not, we don't have power over that, but we can certainly help make sure that that a proposal or an application is, is answering the questions that we think that they're going to need to answer, that the IRB will question. So for sure. April, do you have any additions to that?
I agree with that. Yeah. So just anything that, as far as putting your protocol together, we can assist with, but the actual evaluation and approval is going to be up to the IRB committee.
Question. This is Banush. Hello.
Yes.
Go ahead.
Yeah. So you talked about program evaluation versus research. So for program evaluations, you may not necessarily need IRB approval. Is that right?
It depends on what you're going to do for that evaluation. If it's going to be looking at patient data, yes. If it's looking at aggregate data with unique identifiers or no identifiers, you still would probably need to, Banush. I think it's...
No. Let me step in here.
Okay,
so
thanks. I'm trying to think of what we did.
Yeah. We don't want to have, that's a very nuanced conversation, Banush, with very clear guidance on the IRB website about how to make the determination of whether or not this constitutes research or quality improvement evaluation. When you start to think about this, you can do it now as you start to design your project. You're welcome to reach out to either Robin or myself to initiate this conversation. You are also welcome to reach out to Valerie Sanchez at the IRB. She can also help you to start to think about this determination. But ultimately, when the application comes in, that conversation is something that would be guided by the IRB. But Robin and I are certainly happy to help now if you want to think about it. Not every project needs IRB, but every project needs a consideration about whether or not there's human subjects research going on.
Okay, perfect. And then one more question. What is the difference between this award and the one by Dr. Sandmeyer's office? There's an email that, I think it's a collaboration with different schools. I know this program is for like community collaboration. So what
Correct.
is the major, so what is is that the major difference?
Correct. So this is not just about let me go back again and highlight for you. This is really, really, really important that everyone understands this. This is a specific funding mechanism to fund a partnership between a community engaged group and a research person here at the university. If you partner across campus here, like the School of Social Ecology and the School of Medicine, that would not be eligible for funding under this mechanism. You have, if you're a community group in the out in Orange County and you want to partner with a group in Los Angeles, that's beautiful, but you still have to bring in a UCI faculty member. Even if you're partnering with somebody from UCLA, like great school, but you still won't be eligible for this funding. You have to have a research person here at the university, and you have to have a community partner within in the world. Does it have to be Orange County? It does not have to be Orange County, but we generally, you'll find that if you can partner with someone in Orange County, those proposals tend to rise to the top, both in terms of feasibility and also because our reviewers value stimulating relationships in our own backyard. But it does not have to, right, Robin? It doesn't have to be Orange County. Yeah, okay. Thank you. She's giving me the thumbs up. Pam, are there other questions?
No, that's it. We're on track.
Great.
Wait, we have other questions. So we have one question that we have is, will the IRB decision-making delay the start of a funding of the project of funding? Yes, it will. If you don't, we can't distribute money until all of the regulatory authorizations have been given. And so that's by NIH mandate. So does that answer your question?
Let me ask a question then to clarify. So what happens if the grant is approved for funding? Then they have to go to IRB.
Mm-hmm.
The time meanwhile is ticking.
Mm-hmm.
So their time, their clock in which to perform this grant doesn't start then. It starts when IRB is approved and they can actually start, correct?
Yeah.
Okay.
That's exactly
right. And that's
right.
a challenge. I mean, that's part of the feasibility that we don't, when we're looking at the timeline that you put up, if we see a very complicated project with a 2-week start run for the IRB, that's going to suggest that the feasibility of the project is not very likely, that there isn't an awareness of how long it takes to do the IRB process. So you want to think about your feasibility really from start to finish, and that the start includes a consideration of human subjects, because I can't imagine you would be working on a project that didn't involve human subjects. The caveat to that would be those capacity building grants. We rarely see human subjects engaged in those capacity building grants. So some of you we're seeing that you're having, you need a UCI Net ID to pull the application. Robin, is it going to be posted on the webpage?
It already is. I posted the website link, and you are supposed to be able to access the application even if you don't have a UCID net. April, do you know about that?
I'd have to double check. Did you go with Joseph to open up the portal or not yet?
Yeah, you're supposed to be able to do it without a UCI Net ID. But yeah, we'll make sure to look into that.
Yeah.
I'll check with Joseph.
Dara, do you want to address Jenny's question about social science versus another kind of science?
Oh, sure. If you, as a side note, as you start to have questions over the next couple weeks, the grant applications are due June 1st. Right, Robin? Let me see you nod your head. I think we're due.
Yeah,
June 1st.
June 1st. It's short turnaround.
Short turnaround. What percentage of the projects awarded are social science based? So that's an interesting question. All of the projects that are funded, I would say, include. I mean, there are questions that necessarily include human health. So human health, broadly defined, it can be health behavior, it can be information, it can be motivation, delivery of improved healthcare delivery, improved social service delivery. I think as part of health, we think very broadly about those social determinants that go along with health. I don't know, social science based, that's a hard question because I would say all of them.
Yeah.
They all involve, you know, improving, addressing human health disparities. They're not all disparities, but the bucket is always in the human experience.
Okay, let's see.
You're also
Okay.
welcome if you want to just ask your question out loud. You don't have to chat it in if you have other questions.
I have a quick question. So hi, my name is Ilham. I'm the one who asked about the Orange County question as well. So I have a community group with whom I worked in the past out in Palm Springs. We did a lot of community engagement, and they also got a PCORI grant. So we've gone through the process of capacity building about 3 or 4 years ago. I was at UC Riverside at the time, which is why that was my community partner for a project. We looked at the impact of aging and HIV infection in this community. I moved to UCI 2 years ago, and I saw this, and it's a really good opportunity for me to re-partner with them again to ask a different question. And so if we've worked in the past and we've shown that we have gone through a capacity building exercise in a different lifetime, can we go straight to the full application process then?
Yes, and I'm sorry, and let me clarify something. You do not have to have evidence of having ever worked with your organization before. You also do not have to have the capacity building. You don't have to be limited to the capacity building grant. The difference between the capacity building versus a pilot really has to do what's the intention of the work. If the intention of the work is to capacity build, then you need to go for that pot of money. If the intention of the work is to conduct a pilot study, then the recommendation is that you go for the other pot of money. And yes, you can submit with a partner that you've partnered with before, assuming that the idea is new. How many grants are awarded a year? Excellent question. So this year, it looks like we have somewhere between $30,000 and $40,000 to give away. We generally find that if they're good proposals, we shop really hard to get other sources of funding if we can. So as I said, we do have our pot somewhere between 30 and 40 that has been allocated to us by under Dr. Dan Cooper's leadership at the Institute for Clinical Translational Science. How that gets dispersed is really going to come down to, we're not going to say like, you know, we're going to do one, and one. We take each project on its own and we evaluate the merits of that project. And then we sit down and have a conversation around how much funding can we provide to support this project, and try to be as thoughtful as we can to stretch the dollars to cover all of the good work.
Yeah. And for Benusha's question, I believe the answer is yes, you can use some of this funding to support residents, medical students, undergrads, postgrads. It's not denied to them.
But I don't know about, is it yes to faculty too, Robin, for faculty salaries?
She only asked about students and residents.
I just said faculty in there.
You can support the students, but they can't support for tuitions or things like that, but they could be for stipends.
Okay.
So you can stipend and you can do like a pay per hour type thing, right?
Yeah.
Right. And I don't think we'd support faculty salaries.
Right.
Yeah.
We don't for sure.
Yeah, I think, Dara, can you handle this one from Natalie's? I think this is a super important one that should be addressed.
How do you recommend a community organization? How do you recommend a community organization get linked with a UCI research student or faculty member? Okay, your question is honestly like the bane of our existence. It's very, very hard. So let me give you the easy, like happy, shiny answer, and then I'll give you the harder answer. So the easy answer is reach out to Robin, Pam, me, or April. What we try to do is get a sense of what the community group is, what your goals are, where you're looking to go, and then we dig and think about who do we know at UCI that would be a good partner, who you know, who we like, we think is easy to work with. But this is always a frustration that we hear from the community side, that there's a wall at UCI and it's hard to get through. And that is a very legitimate, real frustration. Sometimes we are able to find a faculty member or a student that is great, and it ends up being a really great relationship. And sometimes we're not, or it's not great. So we try to do the best we can. Please reach out. We know a lot of people and can help network to network to network. But it's not easy. The same is true. I'll have you say that when we have a faculty member who wants to reach out into a community group, it's not always easy to find the right community group that has a willingness and the bandwidth to engage in research. So this really is, here the science is important, but the relationship is even more important, because we recognize that stimulating those very early relationships takes time and it's hard. And fundamentally what we want to see is that this project, just like Pam described, is the seed for a collaboration that can grow. And that's really what we're looking to find, is the beginning of starting the beginning of something that can become bigger.
A really happy marriage.
Thank you for that answering my question. This is Natalie. I represent a community health organization, so we'd love to get connected and participate in this research opportunity. So I'm from the Community Health Initiative of Orange County.
Oh, great. So just reach out, to Robin or to Pam. You see Robin's email there, and we will start to think about and do I mean, you're welcome to date, talk to a lot of people to see who do you think is going to be someone that you'd like to go in on writing an application with. And we've seen applications that start very heavy from the research side that move more towards the center of that model to really develop a community approach. And we've seen community applications that really come and are led by the community side and also move towards the middle to take on more of a research angle. So these applications can come from either side of that spectrum. And again, what we're looking for is an authentic relationship that's built on the beginnings of trust, that can then move forward to produce the kinds of outcomes that we all need in order to show that the money was well spent.
Yeah, and I think, Natalie, this is a really good question. And like Dara said, we think about it all the time. And that's one of the things that I'm hoping I can help, is to do a little bit of matchmaking, is because I've always felt that community organizations were not taking advantage of this wonderful opportunity. And I'd like to see that increase. So super appreciate your question.
Thank you.
And then someone asked, can applications be partially funded? Yes, one year what we ended up doing is because we had, I don't remember the number, don't quote me on this, I'm gonna say 4 great applications. We ended up cutting everybody a little bit so that we could fund the 4th application. So everybody got a little bit less, but we were able to accommodate one more application and managed to merge in a teeny bit more money. So just as we said, we're going to try and find funding for applications that rise to the top. There is a review process, and all the applications do get scored by at least 4 reviewers, 2 scientific reviewers and 2 community reviewers. So there's 4 reviewers for every application. We hold an in-person study section type meeting, or I guess maybe this year it'll be Zoom. Every application gets discussed and rescored, and then we make funding decisions. Well, we take those to a bigger group to make funding decisions, but we make recommendations.
So,
all right.
Dara, we have a question here. Does UCI host pages of research from faculty to help guide community organizations to a possible match?
Yes, there is a UCI faculty profile. Robin, next
it's
time
called
maybe
profiles, right?
Yeah, UCI faculty profiles. If you put that into your Google search bar, it should come up to the profile section, and then you put the keywords in Now, I have to add a caveat here that I generally find this search engine to be really, it's challenging. I've been at UCI for like since 1998. So I know a lot of these people. When I see the names come up, I'm like, that person isn't going to be able to do it. So to go with a caveat, like it's not a slam dunk. I think it's a good place to start, and then to reach out to either Pam or Robin or April or myself, and we can help you to identify like who actually isn't retired or, you know, like who's actually like going to be a good partner.
And we can also, you know, we can also make introductions. So I think sometimes we can help ease the conversation a little bit. Just because we're in the same institution as the faculty. So, you know, if you find somebody and you would like a little help kind of making that contact, you know, that can definitely do that.
That's an excellent point, Robin. So I'm sure, you know, for those of you that are in the community, this is probably the case. I'm going to assume it's true for me that I get so many emails that sometimes it doesn't hit my radar what the ask is, or that this is a cool opportunity. And I may, as I'm going through, just delete a message before I really dig in. And that's one area that Robin and Pam and I can reach into our, you know, that people generally are going, when they see an email from a recognized person or a fellow colleague, they're going to stop for a second and maybe even have that conversation, that 15-minute conversation, where we can explain in a phone call what this is and what the ask is. So we definitely like to be helping out as the matchmaker wherever we can. So again, please like reach out to us for help connecting either to a UCI person or to a community person. Pam, I'm telling you, knows everybody. So
that's because I'm old. So my contact information will be on the slides as well once they're posted. So, but I'm really happy. I'd be really happy to help a community agency get linked up to a researcher that's interested in the community. Let's see. I don't think I see any more chats.
I can
Robin,
circle back to Allison's question about the net ID. So you will need to have your UCI partner actually upload the application. So there's not much that you can see on there. It's basically an upload of every piece that's required for you in the application component. So if you go onto the call on the website, it'll say what's needed, like your budget, your bio sketches, things like that. Those are the pieces, the documents that you'll need to put together to upload to that site that you're trying to access.
hey, Pam, give us your email so that I can add it here so people can reach out to you.
It's pretty clever. So hang on here. It's Pam and my last name Pimentel with EL, RN at Gmail. Because I'm so creative.
Okay, I added that to the slide so
Thanks.
that you all have Pam's as well.
I don't see any other chats. Robin, are you getting other questions?
No, this is Arvin. I just wanted to maybe ask a question. First, I'll start by saying this was really thorough and helpful. So I feel like I should have more questions, but I don't. I feel like I've learned a lot just in this short time. Just to give you some background, we are at the Susan Samueli Integrative Health Institute, and we are operating a clinic, which is an integrative health clinic at Serve the People Community Health Center. It's an independent community center. We're there one day a week and we provide integrative health services, and it's been fairly successful. We've been going 2 years now. And as part of our vision, we started with ensuring that we have, good collaboration, effective services, and good response overall and impact for the community. But we're moving into a phase where we really need to do more research, whether it's looking at the outcome of the integrative services and how it's impacting the community and some of the health outcomes, and also some other areas, including education. So it's a resident clinic and it's introducing certain competencies and opportunities for residents to train in integrative approaches to community medicine. So I can think of multiple ways that we would benefit from a collaborative research project and some support to initiate some of this research. The one research that we've got most developed, and it's in the process of sort of going through the IRB process, we're just getting ready to submit it, is to look at prediabetes and our ability or impact on mitigating risk and progression to diabetes in patients who've got prediabetes. And I guess that one is an easy one. I imagine that would be an acceptable proposal to submit to you guys.
Yeah, it would be.
So
Yeah,
Arvind, what's important that you think about though is it
Yeah.
can't just be that you happen to be operating in a community-based like space. It has to be partnered. So
partner, yeah.
okay, so serve our, remind me the name of the clinic.
Serve
I
the
know
people.
Serve the People. I was
Yeah.
combining it with Share Ourselves.
Yeah,
The
no.
Serve the People clinic would have to receive at least 50% of the funds.
Correct.
And so the money has to go through them in a partnered way. It's important that you make that really clear that this is a partnership. That's probably the biggest, probably the most important piece I think for you is just because since you already have a site there, the reviewers will want to understand that this isn't just research happening in a community space, but it's actually community partnered.
No, I appreciate that. That's good information to have. So from our end, it's very collaborative. The medical director as well as the nurse practitioner are both very involved, and they'd be seeing patients collaborate with us. So I think although in terms of how we communicate that and convey that in our proposal. So I appreciate that. The second question, maybe a little less clear, is whether or not there's opportunity through you guys to
Someone
work
probably
towards
needs the mic. Someone needs to mute their mic. A lot of background noise. Go ahead, Arvind. We'll see if we can.
Somebody's really building a
Tinker Toys.
No,
Okay, got quiet. Good.
The second question, real quick, was whether or not this would be a good place for us to come to if we wanted to develop more clinical guidelines for integrative community health. It's something that's lacking right now. So whether it's best practices or clinical guidelines, but in the context of integrative community health. To help us, we find that that's been a challenge for us is how do we introduce integrative approaches into an existing infrastructure that's so heavily based in conventional model, and that requires some research and some collaboration to develop these guidelines.
I think
So
Arvind,
again, like as you're looking at the how you're going to describe the next steps, what the reviewers are really interested in funding and what the ICTS is interested in funding is efforts that are going to lead to continued research development, programmatic research development. So if the end result of the you get to the end of your application and it says, and now we will have a clinical guideline, that may be viewed or judged as being less innovative as someone who says, and then this clinical guideline will be used to further research in this area. Right. So we're very much interested in directing and facilitating the development of projects that continue to inspire other research, broadly defined.
Yeah, and Arvind, for best practices, I think you've got to really show the partnership with the clinic and how they're going to use or how they're input into the best practice. So it's just, taking it from almost the community's point of view to develop best practices, but your partnership is strong, and that's going to weigh heavily in your favor. And I would imagine everybody on the call probably has that too. So
I appreciate that. Thank you. Thank you so much.
Okay, if you have other questions, we're happy to take them offline, and also we'll have another one of these repeating next week. So as you get into it, if you find you have a new set of questions and you want to sit through the same presentation, but ask questions after, we'll have another presentation next Friday. Until then, take care, everyone. Thank you.
Bye, everybody.
Thank
you so much. Please reach out.
Thanks, everyone.
Thank you.
Thank you, everyone.
Okay.
Thank you very much. That was very helpful.
Great. Thank you. Glad you came.
Yeah, my name's Maggie. I'm working with Arvin at the project he was just talking about. So
Oh, good.
we'll be in touch soon.
Wonderful. Look forward to it.
Thank you. Bye.
Thanks. Bye-bye.